Assalamualaikum and salam sejahtera. Hello everyone. Thank you for having me. My name is Siti Zaharah Zainon. I am student Bachelor of Nursing Science of Honour, BNS, May 2020 semester. My matric number is 800701025856001. This video is to fulfill a requirement of assignment for module OUMH1303 English for Oral Communication Task 1. Today, I am going to speaking to you about informative speech related to cardiovascular disease. What did you understand with cardiovascular disease? Let me define the definition. Cardiovascular disease or CVD is the name for the group of disorder of heart and blood vessel and include hypertension, coronary heart disease or known as heart attack, cerebral vascular disease or stroke, and peripheral arterial or vascular disease, heart failure, rheumatic heart disease, congenital heart disease, cardiomyopathies and deep vein thrombosis, and also pulmonary embolism. What is cardiovascular disease according to World Health Organization? According to World Health Organization or WHO that had published in 17 May 2017, CVDs are the #1 causes of death globally. More people die annually from CVDs than from any other causes. An estimated 17.9 million people die from CVDs in 2016, representing 31% of all global deaths. Of these deaths, 85% are due to heart attack and stroke. Over 3/4 or more than 75% of CVDs deaths take place in low and middle income countries. Did you know 4 out of 5 CVDs deaths are due to heart attack and stroke? And 1/3 of these deaths occur prematurely in people under 70 years of age. And the study shows out of the 17 million premature deaths under the age of 70 due to non-communicable disease in 2015. 82% are in low and middle income countries and 37% are caused by CVDs. Most cardiovascular disease can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physically inactivity and harmful use of alcohol using population-wide, also the strategies for reduce cardiovascular disease. People with cardiovascular disease or who are at high cardiovascular risk due to presence of one or more risk factor such as hypertension, diabetes, hyperlipidemia, or already established disease need early detection and management using counseling and medicine as appropriate. What are the common symptoms of cardiovascular disease? Often, there are no symptoms of the underlying disease of the blood vessel. A heart attack or stroke may be the first warning of underlying disease. Symptoms of the heart attack include pain or discomfort in the center of the chest, pain or discomfort in the arm or shoulder, elbow, jaw, or back. In addition, the person may experience difficulty in breathing or shortness of breath, feeling sick or vomiting, feeling lightheaded or fainted, breaking into the cold sweat, and becoming pale. Women are more likely to have shortness of breath, nausea, vomiting, and back or jaw pain. Why the cardiovascular disease are developed in low and middle income countries? What do you think? At least 3/4 of the world death from CVD occurs in low and middle income countries. People in low and middle income countries often do not have the benefit of integrated primary health care program for early detection and treatment of people with risk factor compared to the people in high income countries. People in low and middle income countries who suffered from CVDs and other non-communicable disease have less access to effective and equitable health care services which respond to their needs. As the result, many people in low-middle income countries are detected late in the course of the disease and die younger of CVDs and other non-communicable disease, often in their most productive years. How can the burden of cardiovascular disease be reduced, or what you can do to avoid a heart attack or cardiovascular disease. Keeping your heart healthy. Keeping your heart healthy is one of the most important ways to make sure you are feeling your very best. If you start doing small things every day that keep your body healthy, you have a better chance of living a longer, happier and healthier life. Having good health will also make you less likely to develop many other types of diseases like cancer or type 2 diabetes. Don't smoke or use smokeless tobacco. How is it? Let me see. Smoking traditional cigarette, electronic cigarette or e-cigarette, or well known as vape, or using smokeless tobacco, also called dip, snuff or chew, are some of the worst things you can do to your body. Tobacco contains an addictive chemical called nicotine that can give smokers a pleasant feeling. Electronic cigarette and vape also deliver nicotine. Just because the products are high-tech doesn't mean they are safe. Using any tobacco product damages nearly every organ in your body and can cause heart disease, also cancer. Using smokeless tobacco is not a safe alternative for smoking. Chemical can be found in smoke or smokeless tobacco. There are thousands of chemicals found in cigarette smoke and smokeless tobacco that also found in other things also. Diacetone we see in nail polish remover, hydrogen cyanide in insecticide, methanol in antifreeze, cadmium in battery, hydrazine, rocket fuel, no? Then also lead also can be seen there. Did you know second-hand smoke is dangerous too? This is important to also avoid smokers too. Breathing in smoke from someone else who is smoking is called second-hand smoking, and this is also hazardous for your heart and lung too. Then remember, if you can smell the smoke, then the chemicals are getting into your body already. 2. Be physically active. Regular physical activity help to keep your heart muscle, bone and joint healthy and strong. Physically activity can also raise self-esteem, improve your mood, help you to sleep better and give you more energy. The American Heart Association recommended that at least 60 minutes of moderate to vigorous physical activity to be done every day. Types of moderate and vigorous physical activity you can do bike riding, swimming, brisk walking, tennis, gardening, jogging, soccer, aerobic, dancing or jumping rope. Now it's your turn. What are your favorite ways to be physically active? Think of 3 things you can do next week to be physically active and track your total activity minute for the week. Eat a heart-healthy diet. Eating healthy food is one of the most important ways to keep your heart and body working at its best. Starting good habit with food that you eat early in life is an important way to keep our heart and body healthy for the rest of our life. Try to eat diet that include whole grain, fruit, vegetable, low-fat dairy product, poultry, fish and nut, while limiting sodium, sugary food and beverages, and also take red meat. Write down everything you eat and drink for a few days. Identify your good habit like choosing healthy snack and eating plenty of fruit, also vegetable, and your bad habit like snacking all day and drinking too many sugary drinks. Next, number 4 is keep a healthy weight. As your body grows and changes through tween and teen years, gaining some weight is part of developing into a healthy young adult. Gaining too much weight at any point in your life can be dangerous too, to your health also. A person is considered overweight or obese when they have more body fat than is considered unhealthy. Now come to your turn. After 1 week, look at your food diary and physical activity log. Ask yourself this question: how much are you eating today? Are you eating out of habit or boredom instead of real hunger? Are you getting enough physical activity? Where you can make improvement? Where is it? Find yourself. Then number 5, keep your blood pressure healthy. How is it? Blood pressure is a measure of how easy or difficult it is for blood to be pumped by your heart through your body. When the heart beats, the blood that is pumped throughout the body exerts pressure against the blood vessel wall. When your heart and blood vessels are healthy, the vessels are flexible enough to expand and contract. This expansion and contraction of the vessel produce the blood pressure. When blood vessels become less flexible or narrow, the heart has to pump harder to get the blood go through the vessel. This causes an increase in pressure in the vessel, or high blood pressure will occur. High blood pressure and your health. High blood pressure or hypertension is an important risk factor for heart disease, and many people do not have any symptom when their blood pressure is high. People with high blood pressure are more likely to have heart attack or stroke than people with normal blood pressure. You can make healthy choice that will help you to control your blood pressure. Keep it in a healthy range by keep your weight healthy, eating a heart-healthy diet, getting enough regular physical activity. 6. Keep your total cholesterol under control. Cholesterol is the waxy substance in your bloodstream and cell that is necessary for your body to function properly. Some cholesterol is important for good health, but too much cholesterol in your body or in your blood is not good for your body, your brain or your heart. When too much cholesterol circulates in the blood, it can slowly build up inside the wall of your artery that feed blood to your heart and brain. Cholesterol and your body. Cholesterol combine with other substances in your blood to form plaque, which is a thick heart deposit that can narrow the arteries and make them less flexible and put you at the major risk for heart disease and stroke. And last, number 7, keep your blood sugar healthy. When you consume food and beverages that contain carbohydrate, the digestive system breaks down the carbohydrate into sugar for energy. Food like whole grain, fruit, vegetable and other high fiber fruit can take longer to digest. Food like refined grain and food high in added sugar are digested very quickly and are quickly delivered into the bloodstream as sugar. If your blood sugar goes high too often, it can overwork the body's ability to keep your blood sugar in healthy range. If this happens, you become more likely to develop diabetes. Diabetes is a condition that causes blood sugar to raise to dangerous level. Untreated diabetes can lead to serious medical problems, including heart disease and stroke. In diabetes, the body can problem either using or making a hormone called insulin. Insulin is important because it helps the body cell take sugar from the blood and turn it into energy the body can use. When the body does not have enough insulin or it does not respond to the insulin, it causes too much sugar to build up in your blood, which can cause damage to your heart and other part of your body. Type of diabetes. There are two main types of diabetes. Diabetes type 1 means the body does not make enough insulin to function. Then diabetes type 2 happens when the person's body does not respond well to the insulin. Remember, being overweight and not getting enough regular physical activity are two unhealthy habits that can increase the risk of developing type 2 diabetes. Diabetes risk factor. Once a person has type 2 diabetes, they are at risk for problems with other parts of their body too. Some of the problems they can develop are heart disease, stroke, high blood pressure, eye damage and blindness, kidney damage, foot damage, even amputation, then also hearing problem. This warning sign that is frequent thirsty, frequent tired, frequent hungry, blur vision, going to bathroom frequently, losing weight quickly. If you have been told you have diabetes, make sure to take your medicine exactly as what your doctor has prescribed. Remember, you can stop heart disease before it starts. Start small and keep it simple. Make one changes today and then you are ready to make another day. By maintaining to what I say just now, avoid smoking and using tobacco product. Be physically active every day. Eat a heart-healthy diet. Keep a healthy weight. Keep your blood pressure healthy. Keep your total cholesterol healthy. Also, keep your blood sugar healthy. Thank you.